I think the most common dental issue I see in this community is what we call malocclusion. Malocclusion means like where your teeth are positioned. I think maybe it's because we're New Yorkers, but we are constantly clenching and grinding our teeth. And I find that in so many of our patients. So our tooth position is really important, especially if we have things like bruxism, which is pathologic, right? That grinding and clenching. If our teeth are not in the right position, you will find premature wear, premature aging. So if we want our teeth to look super young and healthy and vibrant, our tooth position matters so much. So I think that that's the number one thing I see in this community is malocclusion. Dental checkups are super important. I find that when we see our patients twice a year, we're doing something beyond just treating problems. We're being preventative, right? So if something is starting to go wrong, it's better to catch it earlier so we can do the most conservative option in treatment. Another important thing is that maybe not all patients realize is that we're doing oral cancer screenings every time you come in. So oral cancer is something that's super important. We should catch as early as possible. And I think it's vitally important that we as providers are doing that for each patient every time they come in. And that's something we do. So for preventative care, I'd love to see patients twice a year. Advice that I give to parents is, one, they themselves have to have good oral hygiene habits. If you want your kids to have it, you have to also have those same habits instilled in you. But how do you instill it on them? It's really just daily brushing twice a day. Once they're starting to get a little bit older, we want to incorporate flossing because that's important too. The majority of cavities is like right in between your teeth. So if we can floss in those areas and keep them clean, you're going to have less cavities. Another aspect is coming to the dentist early. Like if once your child has teeth, bring them in. We may not necessarily do anything, just meet and greet, sit in the chair, show them the different things and tools that we have here at the office so that as they come every 6 months, it becomes less and less scary. It's a place that they are now comfortable visiting. They've been here before. It's familiar faces. So when they're ready for that cleaning, now we can do it and they're happy. For me, that's what's important. That's how we instill those good values into our kids. It's just the repetitiveness. I think it's most important. You try to make it as fun as possible. We have little timers that I give my kids that show them how, when you flip it, it's like the sand that falls, those old hourglass things. It kind of shows them how long they need to brush for. I brush alongside with them so that they can see that it's important if I'm doing it with them and they're also doing it when they're trying their best. Now, while they do it themselves, I try to encourage that. You always want to check, right? Especially if they're younger. As they get older, they become better and better. The manual dexterity changes. So the tips and tricks that I use is, one, you got to make it fun. Right? Maybe an hourglass, cute toothbrushes with their favorite characters on it, as well as toothpaste that's appropriate for their age, right? Flavor-wise, so be careful they don't eat it, kind of thing like that, because kids love that. But incorporating all that into it definitely helps establish like good hygiene habits. For me, one of the most exciting advancements in dentistry is where 3D printing is going. Like 3D printing is really changing dentistry through and through. There's so many things that can now be printed, things like night guards, things like retainers. You can print definitive restorations. So like if someone came in and had missing tooth, you can print a tooth and put it in that area just temporarily until you get more definitive, like a final option down the road. So the versatility of like 3D dentistry is phenomenal. I love where it's going. It's only just starting to really take off amongst all dentists, but the possibilities over the future, I think, are endless. We do have a 3D printer. I use it to print models, for example, retainers and a few other things, and it has been amazing because I have full control of the product and the designs that are coming out of that 3D printer. So I can take full account for them, how they're designed, the material that's being used, how they fit, and it's done quicker. So instead of having to send it out to a lab, which will do the same thing in their office, we can just do it here. So you can have your appliance or your retainer or whatever it is a lot quicker. Yeah, it's pretty cool. Another tool that I think is invaluable to dentistry, and I think every dentist should have, is a intraoral scanner. I Anytime a patient comes into my office, I always do an intraoral scan. We call it a wellness scan. And what it does is it gives me a baseline scan of the patient. It takes pictures of every tooth. It shows you position, how your teeth come together, and I can save that digitally for years to come. And I think this is important because it gives me a baseline of what you look like today. So if recession is progressing, if you're grinding and your teeth are wearing down, my patients will get a scan every 3 years. And then I can overlay those two scans and show you, hey, you're having a lot of recession in this area. Like, let's act on that. Or you're having a lot of occlusal wear, meaning like you're grinding your teeth down and you're chipping them. Let's get you into a night guard or maybe orthodontics to reposition how your teeth hit. So I think the wellness scan should be a baseline in all offices going forward. So I think that is the coolest piece of technology we have because it really provides for better care of our patients, without a doubt. I have several ways that I make patients very comfortable throughout their visits. And it's super important to me that they are comfortable throughout their visits. If they're not comfortable, you end up leaving with less than positive experience, and that's not what I'm looking to bring to the community and to patients. I want to instill positive experience. So how do I do that? One of the things that we can do is a TV on the ceiling with some noise canceling headphones. I feel like that helps so many patients. Put on the headphones, throw on some Netflix or whatever show you want to watch, start catching up on it. It really helps distract from the work that's being done, right? It's kind of like anesthesia in a sense. I find that is extremely helpful. Another thing is explaining things to patients. If patients understand the procedure they're going through, it really helps them relax because they can anticipate what's going to happen from one moment to the next. Nothing is ever a surprise. And even throughout the procedure, I like to explain things. So if I want to move on to something that's completely different, I'll give the patient a heads up so they know what to expect. Those are like two, more easy tools that I have to help appointments and patients feel more comfortable. The new patient experience at Blue Line Dental is one that I have really worked hard to make a great overall experience. From the moment you give us a call and schedule your appointment, we make it as easy as possible. You can schedule online if you prefer to do that, or you can call and speak to one of our wonderful administrative staff in front. And when you get here, you'll even meet those people that you spoke on the phone with, which I think is so important. Like if you can make like a personal connection over the phone and you're actually seeing that person in my office, I think that that's important. So when you arrive, we try to make things as comfortable as possible. We have things that we can offer you like water and coffee. But once you're finally in my chair, I try to differentiate ourselves through a wellness exam, a very comprehensive oral cancer screening, a comprehensive periodontal screening, and a occlusion screening. So we're checking tooth position, we're checking your gum health, we're doing an oral cancer screening to really rule out any more serious concerns on that front. And the wellness scan, which gives us that baseline of what your teeth appear like today. I think the wellness scan is very cool because it gives you a 3D scan of your entire mouth by taking a bunch of pictures, maybe like 600 or 1,000 pictures, and stitching them together. So then you get to see your whole mouth like laid out in front of you, where your old fillings are, what your tooth position is like. And then we also jump to the cleaning if that's what you need, where then I offer headphones and Netflix, and you can just zone out while you get your teeth cleaned. So I think our new patient experience, I really wanted it to be something special, and that's how I've created that. But it doesn't just end at that new patient appointment. Every time you come in, you'll get that same thing. You'll get that experience with a full oral cancer screening, a periodontal screening, tooth screening, and your occlusion screening. So we can always treat you to the best of our abilities and comprehensively. A common misconception that I think so many people have is that it's painful. Honestly, I think that keeps so many people away from the dentist, and that is so far from the truth, especially with how far technology has come in dentistry. There's so many things that we can do to make patients comfortable, to make sure that they're not feeling pain while they're undergoing treatment. that alone, I think, keeps way too many people away from the dentist. So here at Blue Line, and what I wanted to create was a place where that misconception is erased. We do treatment that is comfortable. We make patients comfortable throughout treatment. We bend over backwards to make sure that patients are happy in the chair. They're happy when they come in, and they're happy when they leave, for sure.